Hi, I'm Nino Isakadze. I'm one of the cardiac electrophysiology fellows at Johns Hopkins. So our research focuses on atrial fibrillation. Atrial fibrillation is the most common cardiac arrhythmia. There is 1 in 5 lifetime risk of developing atrial fibrillation. So it is associated with increased risk of stroke, weak heart muscle, heart attacks, and hospitalizations, as well as really poor quality of life. So there are interventions, including risk factor modification, that can decrease the burden of atrial fibrillation and can reduce the risk of complications. And the risk factor modification is the class 1 indication by guidelines to implement in patients with atrial fibrillation. However, despite this overwhelming evidence, we're doing a really poor job in getting this recommendation in the hands of patients. So together with a diverse group of patients, we came up with the idea that digital health tools that we use in everyday life, such as smartphone or wearable devices, such as watches and fitness trackers, can really help in implementing the guideline recommendations to atrial fibrillation patients at scale. So we developed a comprehensive multi-component intervention leveraging mobile app Cori AFib, as well as smartwatch that monitors the cardiovascular health metrics, leveraging sleep apnea detection with the at-home sleep study, as well as weekly check-ins by our electrophysiology nurses to develop individualized treatment plans with patients with atrial fibrillation. This is a 12-week program, comprehensive again, that is focusing on risk factor modifications for patients with atrial fibrillation. And so far, we have enrolled almost 50 patients in this study, and we are evaluating the feasibility or, the satisfaction and usability of the intervention among patients. And so far, patients love the idea of leveraging everyday tools to improve the outcomes of the atrial fibrillation. So the next stage we're preparing for is to conduct a larger clinical trial, leveraging this multi-component digital health intervention for atrial fibrillation so that we can deploy it in the hands of all patients with atrial fibrillation across the world. Thank you.